Okay, so in this video, we're going to go through the assessment, kind of the treatment of a respiratory emergency. Um, we're going to kind of jump into the call a little bit with um, skipping through the kind of scene assessment stuff. But keep in mind that scene safety, that assessment is a continuous process. It's not a one-time and you're done event, right? We need to continually reassess, is the scene safe? Are there threats to us? Do we have adequate help coming? So for the purpose of our call, we were dispatched for somebody with breathing difficulty. We thought about the possible causes, some of the issues we could face on our way to the call, maybe review some protocols, think about the things that we're going to need to take in with us as we're responding. Once we arrived up on the scene, made sure there were no obvious threats to us, and approached the building in a safe manner, and made contact with our patient. So we're going to just start off again with the patient contact. So as I'm approaching John, my patient, I'm trying to get, again, a good idea of what the general impression is. I can see that he's sitting upright. He's maybe tripoding a little, where he's trying to lean forward, sit up as straight as he can, make his chest cavity as large as he can so he can get in enough air. It's obvious to me, just again from across the room, that his work of breathing is increased. So immediately we know that we've got ABC kind of issues going on. So walk up to him. John, how are you doing today?
I've been better.
Okay. Do you know where you are right now?
Yeah, I'm at home.
Okay, and what day is it?
It's Friday.
Okay, so we've determined that John is alert and oriented. He's oriented to person, place, and time. And we move immediately right into the ABCs. Look, listen, and feeling for the airway. No issues there. Maybe a little bit of noisy breathing, but nothing that's going to indicate airway compromise. Breathing, it's obvious he's working hard to breathe. So we already know there's an issue there with the breathing. And circulation, we're going to grab some quick pulses. On John, they're a little rapid. Again, that's going to be an expected finding in somebody who's having trouble breathing. Jumping back to my breathing assessment, in addition to that, we can throw pulse ox on him. And let it take its reading. And we can grab some quick lung sounds. Again, lung sounds comparing left to right in about 3 places. Tops of the lungs, middle of the lungs, through a complete respiratory cycle, and then the bases of the lungs. Okay, so on John, I've noticed that he's got some slight wheezing going on. His SpO2 is a little low. We're down around 94, 95%. So in that case, we'd probably want to go ahead and apply our oxygen at this time. For John, we're going to just set him up with a nasal cannula. Okay, so my ABCs have been completed. No altered mental status. We don't need to worry about any disabilities, anything like that. So we can break right out into having my partner go ahead and collect some vitals for us, and I can start sample OPQRST. So what's happening today, John? What's going on?
I don't know. I was just kind of exercising a little bit. Nothing crazy. I was just working out with a DVD, and I just became short of breath, and I couldn't catch my breath, and so I stopped and I sat down.
Okay. Are you allergic to any medicines?
Yeah, penicillin.
Okay, penicillin. Any medications?
Yeah, I take. Well, I don't know what it is. It's an inhaler.
Okay, like a puffer?
Yeah.
Okay. So past medical history then?
I've got asthma.
Okay. Any other issues? Breathing issues? Anything else you might take medicine for?
No, usually it just comes on if I really exert myself, but I was trying to take it easy and not do that.
Okay. And you mentioned that you had an inhaler. Have you tried that?
No, I don't know if I'm out or if I just can't find it, but I haven't taken anything yet.
Okay. And then have you eaten anything today?
Yeah, I had lunch.
Okay. What did you have for lunch?
I had Burger King.
Okay. So no food allergies that would be of a concern there with your Burger King
No.
meal. Okay. So at this point in the call, we've got a really good idea what's going on. Probably really strong indicators that he's having an asthma attack. We've kind of eliminated the possibility of it being some type of allergic reaction issue like that, which can similarly present to an asthma attack. So we'll move into OPQRST. So we know what was happening when the onset happened. Is there anything that makes this better or worse? Does it get better as you rest?
maybe a little, but doesn't go away.
Okay, so that takes care of our provoke. Now we want to skip through radiation, right? Because breathing difficulty doesn't really radiate, doesn't go anywhere, but we can go into severity. So compared to your past asthma attacks, John, how is this on a severity scale?
I mean, pretty mild. I mean, I'm working to breathe a lot, but before I couldn't catch my breath at all. I felt like I was gonna pass out.
Okay, and so probably at this point in the call, we know the time. How long has this been going on? I guess you could specifically ask me
Yeah,
down.
probably. I don't know, maybe 30 minutes. I thought it'd go away, but it didn't.
Okay. So obviously now I think we pretty well figured out that it's an asthma attack. We can do a couple other things to maybe eliminate some other respiratory type issues. That's primarily going to be driven um, by our hands-on or physical exam. But at this point, I feel like I've collected enough information that I could maybe go ahead and direct my partner to go ahead and start a breathing treatment. So we're just going to simulate that for the purposes of this video. But at this point in time, we put John on an albuterol breathing treatment through a nebulizer. And I'm going to continue on and do a quick physical exam. So for the physical exam on John, we can feel the chest rise and fall, make sure that it's equal. We listened to breath sounds when we were assessing the breathing, so we know that he has equal chest. His breathing is equal across both lungs. The only thing we may want to do is take a quick peek and just make sure that he doesn't have any rashes. Again, making sure this isn't some kind of allergic reaction. And then finally, for a physical exam on your respiratory patients, you want to get a look at their ankles. If they have any type of history of congestive heart failure, or perhaps you're catching new onset congestive heart failure, a lot of times you'll catch that by checking, see if there's a pedal edema or swelling around the ankles. So we've completed our assessment. We did a physical exam. We collected vitals. My partner did those for me. His vitals are stable, and we've got the breathing treatment running. At this point, we would probably be ready to go ahead and move John on into the ambulance. And from that point on, it's just going to be reassessing. So seeing how the medicine is affecting him. Is it getting the desired effects? Is he improving? Is he getting worse? And rechecking vitals, probably on this guy since he's stable every 15 minutes, and then making our call to the hospital. So hopefully this gives you a quick overview of what the assessment and kind of treatment of a respiratory patient would look like.